Welcome to Armor Safety and Compliance's COVID-19 Coronavirus audio presentation. Let's begin with a series of questions. Question 1. What is COVID-19? COVID-19 is the coronavirus disease 2019. It is a respiratory illness that can cause spread from person to person. The virus that causes COVID-19 is a novel coronavirus that was first identified during an investigation into an outbreak in Wuhan, China. Question 2. Can I get COVID-19? Yes. COVID-19 is spreading from person to person in parts of the world, including California. Risk of infection from the virus that causes COVID-19 is higher for people who are close contacts of someone known to have COVID-19, for example, healthcare workers or household members. Other people at higher risk for infection are those who live in or have recently been in an area with ongoing spread of COVID-19. Question 3. What are some of the symptoms of COVID-19? Patients with COVID-19 have had mild to severe respiratory illnesses with symptoms of fever, cough, and shortness of breath. Question 4. What are severe complications of COVID-19? Some patients have had both pneumonia in both lungs and multi-organ failure, and in some cases, death. Another important question is question 5. How COVID-19 spreads. The virus is thought to spread mainly from person to person between people who are in close contact with one another within about 6 feet of each other, through respiratory droplets produced when an infected person coughs or sneezes. These droplets can land in the mouths or noses of people who are nearby or possibly be inhaled into the lungs. Continuing on question 5, how COVID-19 is spread, it may be possible that a person can get COVID-19 by touching a surface or an object that has the virus on it and then touching their own mouth, nose, or possibly their eyes. But this is not thought to be the main way that the virus spreads. The virus is considered to be community spread, and that is considering that it is easily spread and sustainably spread within the community. Question 6. Can someone spread the COVID-19 virus without being sick? People are thought to be most contagious when they are most symptomatic, which is the sickest. However, some spread might be possible before people show symptoms. There have been reports of this occurring with this new coronavirus, but this is not thought to be the main way the virus spreads. Question 7. Is there a vaccine for COVID-19? There is currently no vaccine to protect against COVID-19. The best way to prevent infection is to take everyday preventative actions, like avoiding close contact with people who are sick and washing your hands often. Question 8. Is there a treatment for COVID-19? There is no specific antiviral treatment for COVID-19. People with COVID-19 can seek medical care to help relieve symptoms. On March 19, 2020, the Governor of California declared statewide shelter-in-place order for all of California. Officials ordered state residents to remain in place at their homes except for essential activities, essential business, and essential government functions, including, number 1, tasks essential to maintain health and safety, such as obtaining medicine or seeing a doctor. Number 2, getting necessary services or supplies for themselves, their family, their household members, or their pets. Number 3, engaging in outdoor activities such as walking, hiking, or running, provided that they maintain at least 6 feet of social distancing. Number 4, caring for a family member in another household. Number 5, caring for elderly, minors, dependents, people with disabilities, or other vulnerable persons. The shelter-in-place order also does not apply to those going to work in an essential business or an essential government. Some of these essential businesses and government functions would consist of healthcare operations, healthcare workers, essential infrastructure, construction, public transportation and utilities, grocery stores, farmers markets and food banks, convenience stores, businesses that provide necessities of life for economically disadvantaged individuals and shelter facilities, pharmacies and healthcare supply stores and healthcare facilities, gas stations and auto repair, banks, garbage collection, energy producers, hardware stores, plumbers, electricians, and other service providers necessary to maintain the safety, sanitation, and essential operation of residents and other essential businesses, educational institutions, laundromats, dry cleaners, and laundry service providers, businesses that ship or deliver groceries, foods, and goods directly to residents, child care facilities providing services that enable essential employees to go to work, roles required for any essential business to maintain basic operations, which include security, payroll, and similar activities. Let's review this U.S. Department of Homeland Security Essential Critical Infrastructure Workers Chart. Communications, chemical, commercial facilities, critical manufacturing, dams, defense industrial base, emergency services, energy, financial, food and agriculture, government facilities, healthcare and public health, information technology, nuclear reactors, materials and waste, transportations, systems, and water. Question 9. What if I can't work? This may be a serious question for most of us. EDD is prepared to assist individuals who are unable to work due to the COVID-19 outbreak. Benefit amounts are approximately 60 to 70% of wages and range from $50 to $1,300 a week. This will help assist employees who may be sick or quarantined, employees who may now have caregiving obligations to ill family members or students from school closures, employees who have now reduced work hours from the shelter-in-place order or from working from home, and potential layoffs from potential closures. If you have more questions regarding this subject, please review the link below. Prevention. Prevention is our main weapon against COVID-19. The President of the United States of America has asked that all Americans keep all gatherings to 10 people or less, and as well as in these gatherings to keep a distance of 6 feet or more. Please remember that respiratory droplets produce when an infected person coughs or sneezes, and these droplets can land in your mouth, your nose, and can be breathed into your lungs. We need to continue to wash our hands and to make sure that we avoid touching surfaces that may be contaminated, with following touching our eyes, nose, and mouth. Protect yourself. Take steps to protect yourself. Clean your hands often. Wash your hands often with soap and water for at least 20 seconds, especially after you have been in a public place or after blowing your nose, coughing, or sneezing. If soap and water are not readily available, use hand sanitizer that contains at least 60% alcohol. Cover all surfaces of your hands and rub them together until they feel dry. Avoid touching your eyes, nose, and mouth with unwashed hands. Avoid close contact. Avoid close contact with people who are sick, and put distance between yourself and other people if COVID-19 is spreading in your community. This is especially important for people who are at higher risk of getting sick. Protect others. Remember, we don't want to just protect ourselves, but we want to protect those around us. Take steps to protect others. Stay home if you are sick, except to get medical care. Cover your mouth and nose with a tissue when you cough or sneeze, or use the inside of your elbow, and throw all used tissues in the trash. Continuing to protect others means wearing face masks. If you are sick, you should wear a face mask when you are around other people, sharing a room or a vehicle, and before you enter a healthcare provider's office. If you are not able to wear a face mask, for example, because it causes trouble breathing, then you should do your best to cover your coughs and sneezes. And people who are caring for you should wear a face mask if they enter your room. However, if you are not sick, you do not need to wear a face mask unless you are caring for someone who is sick and they are not able to wear a face mask. Face masks may be in short supply, and they should be saved for caregivers. Disinfect. Remember to take those steps to protect others by disinfecting. Clean and disinfect frequently touched surfaces daily. This includes tables, doorknobs, light switches, countertops, handles, desks, phones, keyboards, toilets, faucets, and sinks. If surfaces are dirty, clean them. Use detergent or soap and water prior to disinfection. To disinfect, most common EPA-registered household disinfectants will work. Use disinfectants appropriate for their use. Options include diluting your household bleach to make a bleach solution mix, 5 tablespoons of bleach per gallon of water, or 4 teaspoons bleach per quart of water. Follow manufacturer's instructions for application and proper ventilation. Check to ensure that the product is not past its expiration date. And never mix household bleach with ammonia or any other cleanser. Unexpired household bleach will be effective against coronavirus when properly diluted. Symptoms reviewed. Call your doctor if you think you have been exposed to COVID-19 and develop a fever and symptoms such as cough or difficulty breathing. Call your healthcare provider for medical advice. Watch for those symptoms. Reported illnesses have ranged from mild symptoms to severe illnesses and death for confirmed coronavirus disease 2019 COVID-19 cases. The following symptoms may appear 2 to 14 days after exposure: fever, cough, and shortness of breath. Emergency warning signs. If you develop emergency warning signs for COVID-19, get medical attention immediately. Emergency warning signs would include difficulty breathing or shortness of breath, persistent pain or pressure in the chest, new confusion or inability to arouse, bluish lips or face. This list is not all inconclusive. Please consult your medical provider for any other symptoms that are severe or that are concerning. Testing for COVID-19. If you are a close contact of someone with COVID-19, or you are a resident in a community where there is ongoing spread of COVID-19 and develop symptoms of COVID-19, call your healthcare provider and tell them about your symptoms and your exposure. They will decide whether you need to be tested, but keep in mind that there is no treatment for COVID-19, and people who are mildly ill may be able to isolate and care for themselves at home. People at higher risk for serious illness from COVID-19 should contact their healthcare provider early, even if their illness is mild. Older adults and people who have severe underlying chronic medical conditions like heart or lung disease or diabetes seem to be at higher risk for developing more serious complications from COVID-19 illness. If you are very sick, get medical attention immediately. If COVID-19 is spreading in your community, take extra measures to put distance between yourself and other people to further reduce your risk of being exposed to this new virus. Stay home as much as possible. Consider ways of getting food brought to your house through family, social, or commercial networks. If a COVID-19 outbreak happens in your community, it could last for a long time. An outbreak is when a large number of people suddenly get sick. Depending on how severe the outbreak is, public healthcare officials may recommend community actions to reduce people's risk of being exposed to COVID-19. These actions can slow the spread and reduce the impact of the disease. Have a plan for if you do get sick. Consult with your healthcare provider for more information about monitoring your health for symptoms suggestive of COVID-19. Stay in touch with others by phone or email. You may need to ask for help from friends, family, neighbors, community health workers, etc. if you become sick. Determine who can care for you if your caregiver gets sick. After a COVID-19 outbreak has ended in your community, follow up. Remember, a COVID-19 outbreak could last a long time. The impact on individuals, households, and communities might be great. When public health officials determine the outbreak has ended in your community, take time to improve your household's plan. As public health officials continue to plan for COVID-19 and other disease outbreaks, you and your household also have the important role to play in ongoing planning efforts. I hope that this PowerPoint has been beneficial and useful and informational. I hope that you and your families are well and healthy. I hope that this has answered any and all of your questions regarding COVID-19. However, if you do have any further questions regarding COVID-19, please reach out to Armor Safety and Compliance. You can reach us at Logan Kelsey, lkelsey@armorsc.com, or Jonathan Cormier, jcormier@armorsc.com, or Ryan Perkins, rperkins@armorsc.com. We are here gladly to help and assist you and your family and your company and our community as much as we possibly can. Thank you, and stay safe and stay healthy.